If you've been to the chiropractor, the physical therapist, the massage therapist, and your pelvis is still unbalanced or one leg shorter, this video is for you.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum. This is Back at It with Dr. Decompression. Welcome. This is Dr. Dudum. This is the Back at It with Dr. Decompression 52, episode 52. Why are my hips always off? They never seem to balance out. They're always off no matter what you do. So this is the topic I'm going to discuss today. It correlates with a clinical patient we had last week. She came into the office. Her name is, we'll call her Sally. Sally came in, lower back pain, SI joint pain, butt pain, and it trickled down to her hamstring. Very common, extremely common. She goes to a chiropractor every 10 days to get adjusted. It helps, and it always comes back. She has an MRI. Her MRI shows 2 bulging discs and 1 herniated disc. So remember, the jelly is kind of out of the annular or the ring or the donut, so to speak. And it's on the nerve. It's irritating the nerve. So this is what's going on. And she is asking about adjustments, and she always needs them. And the purpose of this episode and video is if you need adjustments every 10 days to balance out your pelvis. What do I mean by that? I mean, if your pelvis, for the listeners, touch your ribs on your sides, and the viewers, you can see me touch your ribs and then go down, you can feel your pelvis there, those wing bones. They should be relatively even. We're all a little distorted, a millimeter or two. We're all off a little bit. That's okay. But when you're feeling like one is really higher than the other, or you're rotated, maybe if you're, this is so common if you're getting tailored for pants, women or men, and like, oh yeah, you're right, your leg's a little bit shorter on one side. Now there is a 0.003%. There's some stat. It's very minimal that your leg is actually shorter, meaning that the bones in your legs are shorter. And if you have an imbalance, you can correct that with chiropractic work and PT and you can. But if you're relying on that every week for 2 years, you're not addressing the problem. So this patient, Sally, came in and I did some very, very simple testing. And it's so obvious that the disc, I'm showing the viewers here, the disc herniation here that's on the nerve is creating a compensatory pattern for her body. So check this out. Her body does not want that disc herniation. It's on the nerve. It's abutting the nerve and it's trickling down her leg. Her body doesn't want that herniation or the jelly to get out more. So her body's going to compensate. If this is her left side, the QL muscle is going to contract a little bit. Her paraspinal muscles are going to contract. Her piriformis and her glute medius is going to contract. All of it's going to contort to that one side to protect her body from itself. That's why you foam roll your piriformis muscle and it never goes away. If we were to get adjusted in this area or in the pelvis, it feels better because you're working on the compensation, but it goes right back. The underlying cause, guys, of that problem is the disc. So we knew it was a disc injury on her MRI and the testing, but if she didn't have an MRI and we went about this story with Sally and I did my testing, I would say, hey, you most likely have a disc injury and we should get an MRI to figure out how we're going to fix this thing. So that is the problem. She's had this pain for 5-7 years off and on. It's progressing and getting worse. When you do the right treatment, the results should be really quick. It should not take that long. Now, there are variances in severities, right? So you could have severe spinal stenosis in multiple levels. You could have severe degenerative disc disease. You could have a 1.6 centimeter disc herniation versus a 4 millimeter. I mean, yes, it matters. The length of healing matters, but The point of my story is there should be progression of your healing. You shouldn't be the same progression here as you were 3 months ago, unless you've plateaued. So 1 week in treatment, 1 week into treatment, Sally is 50% better. How did we do that? She has a disc herniation. It's on the nerve. We're doing testing to see, hey, if I pull and I oscillate that disc, the material there, is it going to change the pressure? Is it going to change what's called the intradiscal pressure and allow that disc to come back in a little bit off of the nerve? And is that going to just settle her nervous system and settle the compensatory pattern? Think about this. I haven't touched her piriformis muscle, her QL, or any hamstring muscle. I haven't touched it. All we did was 3 sessions of spinal decompression at the right angle, with the right amount of weight, and the right amount of oscillation cycle. Remember, so oscillation is how far does it go out, like an accordion, how much does it go in, out, and in. And we can change that. You can go like this. So for the listeners, I'm going really wide, or you can go in and out, more stretchy. Very technical term. 3 sessions, she's 50% better. I didn't touch her glute or her hamstring or her QL. Those are tight, not because they are actually tight. The brain and your nerve system is creating that spasm to protect your body. So we're actually treating the cause of the problem. So how do I know this, or how am I so experienced in this? 2 reasons. Number one, I see it every day. So I have a lot of clinical experience as we've approached and probably surpassed 30,000 decompression sessions. Number two, if you listen to episode 3, when I described my story and why I got into spinal decompression, this happened to me. 5 years ago, my back was hurting. My butt was on fire. My muscle was on a spasm. I thought there was an ice pick on the side of my hip, and it trickled into my toes. And I'd foam roll it. I'd do a figure 4 stretch. I'd do any clamshell, anything you could think of. And it not only did not make it better, it made it a little worse. There were periods of relief, worsening, just a yo-yo of symptoms of relief. And when I did the decompression for 8 weeks, do you think I had any hip pain? My hip pain went away. It's not the hip. It's not the glute muscle. It's not the QL muscle. It could be. It could be. And if you foam roll it and get massage and get some physical work done in a month, it should be better. If it's not better in a month, it's not your hip. It's coming from your lower back, most likely a disc injury, a herniation that's affecting the nerve. And it might not be on the nerve, but it might be that disc herniation, is not on the nerve, okay? So it's not touching the nerve, but that is causing havoc on your system, and your system is protecting it. So you're getting a spasm in some of those compensatory muscles, like a hip stabilizer and a back stabilizer, like the QL muscle. And that's what's creating this problem. So it can be a budding nerve. It doesn't have to be. It's also something I get all the time speaking with patients and people at soccer games and school events, parents. Yeah, I got a disc bulge, but it's not on the nerve. It's not that bad. It's a 4 millimeter disc bulge. It's not on the nerve. You've got a 4 millimeter disc bulge. It's getting closer to the spinal cord. It's not on the spinal cord. It's not on the nerves, but it's in an area that there shouldn't be really anything. And that could be causing havoc on your system. That's what it is. And if you stretch for 2 weeks and it goes away, don't worry about it. You're good. But if you're not, and you're doing something for 5 years and it's not getting better, that's where you're not finding the cause and you're not addressing the true cause. What it is.
So I'm really happy for Sally. Her disc herniation is on the nerve or affecting the nerve, and that's what's creating the problem and the compensatory issue with her body. Just 1 week, okay? If you're doing something and it's not working, or you're not progressing, and it's been enough time, you got to do something different. So that's the story for today. It's my experience with my disc herniation and my hip. It's also what I see every day, and I'm highlighting Sally's case so you guys out there know, how can you get past this hip, QL, lower back, trickle down your leg? Look at the disc. Get tested with decompression to see if it would work. Start a program, get your life back that you deserve. Okay? It's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve. Okay? Episode 52, thanks to our sponsors, PillowWise USA and PowerPlate. And hey, if you have any questions or you want to have your question be on the next podcast, subscribe to the channel here on our video. And if you're listening, don't forget to hit the subscribe button. Thank you for listening. I look forward to seeing you guys next time. Thanks.